Good afternoon, everybody. Thank you very much for joining us for this second webinar. We're running here from Ulster University. We're running it in partnership with the Doctoral Midwifery Research Society, with the Maternal Fetal and Infant Research Centre, and with as part of our Connect People work that we're doing across Europe. So I'm just going to run through a couple of slides here with you, so that you can have a little understanding about, first of all, what this Doctoral Midwifery Research Society is, because some of you have again asked us, what is it? It's a society that we formed in 2007, and it was funded by the R&D office in Northern Ireland. It was funded to provide at that time a platform for sharing research. It's a dissemination vehicle. It's an opportunity for researchers who are doing high-level research to share their research with the rest of the world. And part of the Doctoral Midwifery Research Society is to reach out to parents and parent groups and work in partnership with them. So we do work closely with the National Childbirth Trust and with local parent groups. So you can see from this slide that the original objective and the main objective is, of course, still to provide the quality support and guides to doctoral and postdoctoral midwives and childbirth researchers regionally, nationally and internationally. And we have been involved in considerable research since the start of the DMRS. Anybody who is interested in childbirth research, we would encourage you to join the Doctoral Midwifery Research Society. It's free, and on the website have quite a lot of very useful resources, and we try to share events like this, and we try to put up videos of these events so that people can find them very easily on YouTube. And we also support researchers to put forward their synopsis of their research or significant research papers that they've published and that they're allowed to share with us. We certainly encourage them to use that site as well to publish research. And if you like to have a little look at this, you'll see that we have a Twitter handle and a Facebook presence, and we also have our YouTube channel for our videos. The research team that leads on this particular work package, called Work Package 7, Connect People, there's myself and there's Dr. Julie McCulloch, who's our research associate. Many of you already know, Julie's an excellent researcher, and she's working on this EuroCat-Link Connecting People project. So to your right then, on the bottom of the slide, is Dr. David Elliott, who's in the background today doing all the organisation of technology, and he's been involved in creating our videos for us. And above right then, we have our consultant geneticist, Professor Anna Latos from Poland. That's the team. And in terms of a little bit of information about the Connect People project that we're involved in, this is a European research project that's funded by the Horizon 2020 monies, and we're working across 9 countries. We're looking specifically at children who have one of these four congenital anomalies: a severe heart disease, spina bifida, cleft lip and palate, and Down syndrome. What we're trying to do is we're trying to build an e-form, in an electronic form. We're trying to make the technology work for us. And a part of that is today's event. We're investigating, we're testing the online methods. We're trying to connect and share our knowledge, share the experience of parents, share the good tips, and share the expertise of top quality researchers. And we want to share information about heart disease, spina bifida, cleft lip and Down syndrome in children. And we are determined, and we are motivated, and we are more than willing to work with parents as well as researchers and students to develop new ways to communicate research findings. Now we want to develop new ways to communicate research findings, to make those research findings easily understood by parents. So we are working very closely with parents to help, and they're helping us to take some of the information that we have already obtained from research and help us to make it more understandable. So using really good graphics and to make the story visible. And my colleagues in the room are probably laughing. And if you haven't heard the word ocular centrism before, you're going to hear it again today. And I can hear David in the background twitting and laughing, and Julie. But oculocentrism is a theoretical, it's a theory about how we need to see to believe, and that's why it's so important that we have really good graphics, that we use words, we use videos, we use infographics, we use whatever we can to make the information that we want to communicate to people as visible as possible. So oculocentrism is about trying to make our communication more visually presentable from our perspective anyway. So this is a project that's for everyone. It's for parents, it's for families, it's for support organisations, charities, researchers, academics, healthcare professionals, educators, and all the other stakeholders. And you can see here, if you want to join in or know anything more about our Connect ePeople project, you can do so. You can log on to this website here, and you'll find out lots of information about this study and all of the other aspects of the study. Now, today I'm delighted that we have a paediatric cardiac consultant in the room with us, an expert in this field, a gentleman, a humanitarian, a very approachable human being, and his name is Professor Frank Casey. Now, Frank is a consultant paediatric cardiologist, and he works at the Royal Belfast Hospital for Sick Children here in Northern Ireland. He's also a visiting professor to our Maternal Fetal and Infant Research Centre, and that's in the Faculty of Life and Health Sciences here at Ulster. And he also has an honorary senior lecturership role in child health at Queen's University Belfast. So he's perfectly positioned with a foot in each campus, and that is absolutely marvellous for us. So Frank trained in paediatric cardiology in Belfast and at the Hospital then for Sick Children in Toronto, and his areas of clinical expertise are fetal cardiology and, fetal cardiology and inherited cardiac conditions. And Frank set up the fetal cardiology service in Northern Ireland, and he's been head of that since 2003. And he's also the clinical lead for the newly developed All Ireland Paediatric Cardiology Network. And until recently, he's been the chairperson of the Psychosocial Working Group with the Association for European Paediatric and Congenital Cardiology, and he remains in the council of that group. So for more than 20 years, Frank has been leading a research programme in Belfast and has been focused on the biophysical, the neurodevelopmental and the psychosocial outcomes of children with congenital heart disease. His work has pioneered interventional programmes to modify lifestyle behaviours in children treated for congenital heart disease. And he's also the co-editor of the book Congenital Heart Disease and Neurodevelopment, and that was just published in 2016. Frank has been a pioneer in researching the implications of telemedicine to paediatric cardiology. He's published widely in the area. He's, in our eyes, he is an international expert in this particular field, and we're delighted that he's going to be sharing some of his research with you this afternoon. Professor Casey, over to you.